Yeah. Hello, everyone. Good morning to those of you who are joining us from the West, the US, and nearabouts. And good evening to everybody joining from the other side of the globe. I am Nisha Venugopal. I'm Program Manager at IndoUSrare, and it is my great pleasure and privilege to welcome you all to our very first Rare Disease Day at IndoUSrare. We have planned this as a conversation on the rare disease patient experience in the US and the Indian subcontinent. And our conversation features guest speakers, Dr. Sai Kaustuv Dasgupta and Ms. Christine von Raesfeld. We also have a very special session at the end today where the awards for our recently conducted Art for Rare contest will be announced. Before we begin, uh, I would like to share with you a brief overview of IndoUSrare, our vision, and our programs. Uh, Let us start by refreshing our understanding of what a rare disease is for those of you who are uninitiated and how it is defined. In the US, it is defined as one that affects fewer than 2 lakh or 200,000 Americans. And in India, it is defined as rare if it affects fewer than 500,000 uh, people. Now, please note that this is not 1 in 200,000 or 1 in 500,000. It is a total of that many people in the country. The US was a pioneer in this space and brought out the US Orphan Drug Act in 1983, which incentivized companies to work towards orphan therapies for orphan diseases, as rare diseases are also called. And this has resulted in over 600 orphan therapy approvals in the last 37 years, as compared to less than 10 in the decade preceding the act. This is impressive. But then collectively, we need to remember that we have over 7,000 rare diseases and more are being discovered every year. And only a small percentage have any evidence based therapies approved by the FDA, EMA, or JPA combined. So, this is an issue. As Dr. Christopher Austin, the director of National Center for Advancing Translational Sciences at NIH, put it, at the current rate we're at, it will take us 2,000 years to have at least one therapy for every known rare disease. Now, what is the problem? The image on the screen shows the global distribution of clinical trials available on the clinicaltrials.gov, which is the world's largest clinical trial registry. As you can see, most of the clinical trials are conducted in the US or the EU, which is highlighted in red, and the rest of the world are far behind. And only 3% of this happens in the Indian subcontinent. This is a problem because this region contributes to over a quarter of the world's population, and 3% of clinical trials here is really, really low. IndoUSrare aims to address this key issue by building collaborative bridges between the Eastern and Western hemispheres to accelerate affordable orphan therapies for rare diseases. Our mission is to connect rare disease stakeholders in India, US, and globally to help build collaborations for research and policy development and advocate for rare disease patients. Few of our initiatives through which we're doing this are our Patients Alliance membership program, our Corporate Alliance program, and our programs for education awareness and research. As you can see, most of our activities are focused on cross-border collaborations, which we believe is a crucial step to bridge the divide between the East and West in terms of availability of critical life-saving therapies for rare diseases. We are also working towards advocating for rare disease policy development in the US and India. And this week, as part of the Rare Across America event organized by RDLA of Every Life Foundation, we are speaking with representatives of the US Congress and Senate to advocate for including rare diseases, gene therapy, and telemedicine as part of US India bilateral agenda. I would like to highlight our Patient Alliance program, for which we currently have 19 members who collectively represent over 500 diseases and 15,000 patients from across the globe. How can you engage with IndoUSrare? You can apply for Patient Alliance membership. You can subscribe to our newsletter, stay engaged and informed. You can reach out and refer for possible collaborations or volunteer your time. Please do connect with us on all our social media handles, or personally reach out to us at admin@IndoUSrare.org. Uh, we will now move on to our main program for which we're all here. But before that, a few housekeeping points. Please remember to type in your questions in the Q&A box and we will read them out to our guests. A short feedback survey will be sent out after the event. We request you to complete it promptly so that we can use it for our feedback. And the event will be recorded for those of you who might have to drop off or someone who's not able to join. It would be available on our website as well as our YouTube channel. So without further delay, let's begin our event. I would call upon Dr. Reena Karta, Director of Research Programs at IndoUSrare, to take forward this session. Dr. Reena, over to you.
Thanks, Nisha. Good morning, everyone, and good evening to those of you from the other side of the globe. So today, the last day of February is Rare Disease Day. It is a day when people around the globe come together to let the public and our policymakers know what it means to be rare. Across the globe, the day is marked with different events that are organized with the main goal of raising awareness about rare diseases and their impact on patients' lives. So today at IndoUSrare, we want to engage you all in a conversation about the patient experience in the US and the Indian subcontinent. We specifically want to highlight the commonalities and the contrast in the patient experience in the US versus India. So we have with us today two esteemed guests who will provide their perspectives of living with rare diseases, drawing from their own rare disease experience as well as their journey. They are both well-known globally and have inspired many of us in their unique ways. So first, it's my great pleasure to introduce to you our first speaker, Dr. Sai Kaustuv Dasgupta. Dr. Dasgupta is popularly known as the wheelchair warrior of India. He was born with brittle bone disease called osteogenesis imperfecta and is now 90% differently abled. He has a severe hearing impairment and is confined to an electric wheelchair. By profession, he is an international graphic designer, motivational TEDx speaker, and India's first differently abled certified happiness coach. By passion, he is a singer, entrepreneur, author, Limca India world record holder, inclusion and diversity champion, global and goodwill ambassador for family peace, and founder of a virtual platform called Happiness Unlimited. We all need that. I now call upon Dr. Sai Dasgupta to speak about his journey. Welcome, Dr. Sai, and over to you.
Thank you so much, Dr. Reena, for the overwhelming introduction. Thank you so much, IndoUSrare, and all of you, the audience, the speakers, and Christian. I welcome all of you in this evening of rare evening with the rare people. But this evening, the session will be going to so colorful because we are here for a special reason. We are here for a special cause, and we are going to show you that how much we have to care for the rare. So already Dr. Reena has given my introduction. I'm Dr. Sai Kaustuv Dasgupta, coming live from India, Andhra Pradesh, Puttaparthi, and I'm so happy that this session I can come and join with you all to talk about my rare disease which I'm having, and also a little bit about how it is and what kind of rare disease it is. So I just would like to share my screen, and then I will go through my story. Let me know if you can see my screen. So yeah, so this is the first slide. And already Dr. Reena told, yes, I'm having 90%, I'm 90% differently able person, and I'm having osteogenesis imperfecta. It's also commonly known as OI or brittle bone disease. So among the 7,000 rare diseases of the world, which has no cure till today, osteogenesis imperfecta also comes with an important stand. And it happens because of a rare, that collagen, the lack of collagen in your bones. And I will talk about it later, but this is my introduction already has given by Reena. And because of this disease, I became a wheelchair warrior. And how I became a wheelchair warrior, that's the story. I never actually thought in my life that I'll be confined into a wheelchair. I never imagined my life in a wheelchair. But now, if I look back, I see that people lovingly call me wheelchair warrior of India. And that's because of my willpower, my stamina, my positivity, and that can do attitude, which I showcased all through my life. And I have never allowed this disease to break my heart. The disease has broken all my body parts, but my heart is fully unbreakable. So that is the power, that's the strength I'm having from my childhood. So yes, and because of that, I went to all the places to talk about my story. I have inspired a lot of youth people and young leaders, corporate people, IT professional, doctors through my coachings and through my session to talk about my rare disease, to talk about my motivation, because I believe motivation is something like a medicine nowadays. People need to take it. People need to go through the motivation, because you can't predict whenever something is going to happen to you, like same like my fractures. I never predict my fracture. I don't know that when it will come in my door and say hello. It always uncertain, and that's the most scary part of this disease, that it's all uncertain. You have to accept your life. So more than 50 fractures happen, but all this is one side. Another side, I'm a successful person. I'm leading the global leadership in the disability sector as a fourth global icon after Helen Keller, Stephen Hawking, and Srikant Bola. I'm so happy to lead that whenever you want to do something, you have to talk about it, and that's what I'm doing. I also run a virtual community called Happiness Unlimited, where people join with one only condition, that you have to be happy from heart, not the mechanical happy, not the worldly happy. You have to be happy from all the originality. So this rare disease made all my joints very fragile. It's just like glass, and it always can, it's always need to be so precaution, and it's need to be cautious with my parents. My parents, when come to know about the disease, I'm talking about 1991. That time there was no awareness of the why in the area where I was born. So my parents were very new to that, but they never complained to God. They never said why we are having Sai as a special child. They felt that Sai has a special disease, so that makes them also special parents. They accepted me and they made me to go through, and to numerous fracture up to 50 I counted. Because that time I was feeling that it is a very necessary thing for me to count my fracture. But once it over the 50, I felt like I should start counting my blessing, because counting fracture and suffering, which was already my soulmate, I am now nothing to do in this world to count my fracture. So let me count my blessing, and I will do something for the people in the country, because in the community people think that we are here to seek help, but I wanted to go reach out people and help them to know about the rare disease, to spread the awareness, and what is why. Because until and unless it diagnosed early in the days, and your parents are knowing about the why, what is why, then it is very tough for them to take care, tough for them to make you grow away with all the things in achieve your life. So why, you can see in the slide why it is 25% of why the results of SIP, it's like it's not a hereditary thing. People feel that your parents must have some problem, but I have a younger brother, Kushal. So Dr. Kushal is also fine. He is no problem. So it is not a hereditary disease. It happens, you know, you can't predict. It's happened, and it makes me special. And I always tell that, yeah, I am having a why, and that makes my bones fragile. So I may not do all the things which people are able to do. I have lot of limitation, but those limitation always helps me to understand the lesson of life, how to grow with the security. But in India, I will come further when the question answer session will start. We really have to work miles and miles to catch that smile. in Dr. Sai Kaustuv's smile, because it's really hard to know that what all the things are happening in India, about why we have lot to go, lot to work. But I always try to say that this rare disease day, we are caring for 300 millions of people having the rare disease all over the world. So why people say that it's a disease, it's also rare, why you are celebrating? I always tell that celebrating this rare disease is not nothing to, like, we are here to fight. We're here to fight against our odds. So when we are fighting, we should also be happy and celebrate. We should have our people with us, helping and motivating. Otherwise, this journey, this war, this fight again, everything will go in vain. So that's why we are celebrating our rareness. We are celebrating our everything, our potential, our abilities. Yes, we are being born with some disabilities, some discomfort, some of the problem in our body, but that never make us disabled. We are more than able, and we are showcasing the world that our rare abilities are making us world famous. That's why I'm so fortunate to be in this session of IndoUSrare. And I always tell, this is my favorite quote by me only, that miracle happened to your life when you choose to create that. People think that it's God's miracle, you have to be spiritual. No, it happens to your life when you allow it to create it. And I chose this miracle and made in my life, because I wanted to inspire global differently able people, because we are not only rare, but we are in limited edition, and that's a fact. We are in limited edition, and the world will know about it very soon. And about this session, I'm hoping for the best, to know all this question answer, to educate some of you about the diseases, and to pour some light on our life and treatments and many other sectors. So thank you so much. Over to Dr. Rina.
Thank you, Dr. Sai, for a very motivating introduction. And I should agree that the power of rare is something which people don't appreciate. Rare is special, and it is indeed a limited edition. So please allow me to welcome our second speaker, Ms. Christine von Raesfeld. And she has been living with multiple rare diseases for many years and is a well-known speaker and collaborator. She's the founder, CEO of People with Empathy, and she's a leader in the space. She works to connect rare disease patients to the support they need, as well as to bring the much needed patient voice to medical innovations. So I now invite Ms. Raesfeld to speak more about herself and her journey. Welcome, Christine, and the floor is yours.
Thank you. And thank you for having me, and to Harsha and IndoUSrare for inviting me. I decided to start off the day right in the emergency room. So I am back in the emergency room. But for those of you that don't know my story, my life and my medical history has been kind of this series of unfortunate events. So anything that could go wrong did. But also at that same time, these experiences gave me opportunities to learn, right? So I've been diagnosed with several rare diseases. My most recent being left ventricular non-compaction. I also deal with autoimmune autonomic gangliopathy, thrombotic thrombocytopenic purpura, and a ton of other ones. So I was actually diagnosed with lupus as well. And so I am kind of on this mission at the moment to let people know that sometimes having a diagnosis is not always the answer. And so case in point, my lupus diagnoses led doctors to believe that a lot of my other symptoms were because of lupus. And had I not fought for myself, I may not be here. And so if you're familiar with my story in the last year, it has been a journey, right? It has been 8 ER visits, 15 plus telehealth, all to get a call at the last minute to say I was in full heart failure and needed an ICD, a pacemaker defibrillator. So anyways, now I'm in the ER. I actually just got diagnosed with E. coli and a urinary tract infection and have been throwing up all night. So I'm here. But just, I don't want to flake on you guys. And I wanted to make sure that people knew that, this this is our lives. And even though I'm sick and even though I'm sitting in here and not doing well, there's still a purpose to this, right? And there's still a reason why I'm going through this. And I hope that, the things that we find out may eventually be able to help others. So I'm happy to be here and discuss everything. Thanks, Carol. I see your comment coming in. But sorry, I'm a little off base just because I'm in here, but I'm happy to participate in any of the conversation and go from there. So sorry for being all over the place today.
Thank you, Kristen, and thank you for making it even under these dire circumstances. We really, as IndoUSrare, we really appreciate your participation and your contribution today. So I think I'll get the discussion started. And I guess both of you are very familiar with the healthcare, the scenario of healthcare in the different countries. And maybe you can talk about how these different healthcare systems, which translates into completely different patient experience in accessing the healthcare. Maybe you could give us some details regarding like what are the main challenges you face on a routine basis. I think Dr. Sai, you mentioned a little bit about some of those things that you were talking about, but maybe you can elaborate on it further.
Sure, Dr. Rina. I would love to talk about the challenges we're facing in India because it's India-US rare. So there are some commonalities, there are some contrasts, but the main thing, the main factor that India is that, it is always hard to believe that although we are technologically advancing or medically advancing, but practically the best solutions are not there. In India, during this, osteogenesis imperfecta treatments prescribed by the people, the doctors are like, there are several things that when you have a fracture, you can cure it with the plaster, you can go to the doctor, you can have a plaster for several months, and then your bones will again come. But in my case, I observed that the main symptom of osteogenesis imperfecta is that whenever there is a break, there is a fracture, that portion will not become the all right or how it was originally. It becomes deformity. That's why my all the joints, knee joints, back, my elbows, my hip joints, everything become deformity. So it never break, never joined back again in the same position. It always has some problem. And the second thing doctor suggests in a Y case that physical therapy. And physical therapy also you have to have some causes, like you can't massage or you can't do some physical exercise in the Y patient because of severe discomforts and all the problems in bone. It can break any time, and it's like you have to be very cautious with the physical therapy. But some kind of rehabilitation center are doing biceps and lower muscle, strengthening the muscle because of the bone fracture. Often your muscle become weak, it not works. As you can see, I'm sitting in a wheelchair because last in 2003, when I fall down in a bathroom, and I could not come again in a working position because in the hurry the doctors there made me to plaster in the way I'm sitting now. So that because of that my bone became deformity, the knee joints joined like that. I never could walk again, and that's why I had to accept my wheelchair life. Third thing that the doctors told, always suggest that you can do some surgery to make your bones again fit in the position. But in a place of case of mine where I have having the right hand bent, doctors were very much afraid to do the surgery because it is not one or two surgery. They have to do multiple ones to make the hand right and the knee joints and all. So, and because of the bones are very fragile, they're very just like glass, it is not in a position to accept that much weight of the steel rods or something you are going to surgery. So on end of the day, you have to be believe on medication. There are certain medication. There are Kerala Ayurvedic and homeopathy, all this kind of, it always help to remove your pain little bit, because we are always in pain. I'm talking now, I'm having back pain and everything. Pain is inevitable, it's always there with us, but I felt the suffering is an option. So I feel I have not suffered because I'm mentally strong, but this disease has made me to go through much difficulties, and because of it I am having 100% hearing loss. It is also one of the main criteria that when you have Y, you also have hearing loss. So I used to hear in my childhood, but slowly it deteriorated, and now I am having 100% hearing issues. I can't hear at all with my left ear. I'm using one right ear hearing aid. With that, I'm hearing your words and sounds. And also, Y makes our teeth very weak. You can see when I smile, you can't see my teeth. It's because of we can't chew the strong thing. It becomes very weak, and we don't have strongness in our teeth. So that's also one of the thing in Y. So there are a lot to do in Y. There are association state wise, and we have central association also. But because there is no cure, so people come together, they discuss about what all the activities can be done to make people aware about it. That mainly the parents of Y person very much need to be spread the awareness, because they are the main person to care about you.
Sure.
Most of the time we see that parents are not coming out with the problem, they are shy about telling others that their children or someone in the home is having OI or the rare disease. They don't know how to face the challenge, how to face the public or society. That's what I feel, that why needs to be spread more and more, not only in the terms of treatments, in the terms of awareness, that people need to be diagnosed early, and they should do something uh, all from different angles, that why need to be taken care. And we are also good enough to do everything like you guys are doing, but only difference that the growing part and the challenging, and we have to be taken care from our physical aspect. Yes, it's a visible disability, and that's why people point out towards us, okay, this Sai is coming in wheelchair. I always say, yes, I'm coming in wheelchair. That doesn't matter. You can see my disability. A lot of people are having mental disability also. So it is visible or invisible. That doesn't matter. But what matters is how we are caring about, how we are thinking to make ourselves independent in our society.
So Christine, how do you want to address this question about healthcare access?
So I have a whole a different perspective and maybe just a different idea on the question. Um, I think in the U.S. we look at healthcare as something that is the last ditch effort, right? We don't look at being proactive in our care, and I think that that's actually something that hurts a lot of us, right? I do think that we live in a society where, even now, especially technology is this amazing thing that's coming into play, but we're also at the same time losing our connection with people, right? So I honestly think the main problem with healthcare is we look at healthcare as a solution, and we're not looking at healthcare as something to be proactive about, right? We should have a healthcare system that incentivizes wellness, and instead of coming back and paying all these costs later, right? I think there's a lot of things that can be done. And those of us with rare disease, right? I've dabbled in the precision medicine parts of it as part of Stanford's human-wide program. And I've seen results, right? I mean, I have pharmacogenomics tested, which basically tells me how I metabolize certain compounds of drugs. We know that a lot of my damage from some of these medications is not the medications or my disease themselves. They're actually the treatments that were being used. And if we had done research, we have the technology now. We could find out how people metabolize drugs. We could tailor treatments to people so that you would be better taken care of. But again, we look at healthcare as a last ditch option, right? It's when something is wrong, that's when you go get help, and that's where it has to change. I think we need to go with newborn screening testing. So those of us with rare genetic conditions, we can find these in the beginning. And even with me, misdiagnoses, right? I've been treated for conditions I don't have. I have damage from drugs used to treat things that weren't there. So how do we move forward? And I don't think moving forward is fixing things after the fact, right? I think when people are willing to take a pill instead of taking care of themselves, we have a huge issue with our healthcare. And we could be saving tons of costs, right? We could be saving money everywhere if we would focus on this proactive wellness and not this last ditch effort to save someone.
Yep. So there is a question in the chat box, and some folks are asking. It's Brian Tilton who's asking, what kind of nutrition has your doctors asked you to have for your rare disease? I think it's for both of you. And also maybe a follow-on question, if most illnesses stem from inflammation, would you consider adopting an anti-inflammatory diet to reduce your symptoms? Sai?
Okay, I think Christian is in mute. Yes.
Sorry.
Yeah,
I
so
was
you
gonna
can go
say,
ahead. Yeah.
personally for myself, so I have other issues as well. I have gastroparesis, I have other stomach issues. I do have autoimmune autonomic gangliopathy. So I don't have a desire to eat ever. I eat mostly socially. I eat when other people are around, and taking care of my roommate is when I eat. So for me, diet, nutrition, it is something that's important to me. But it's not my huge main focus. And I hate to say that because I know nutrition does make a big difference. But for me, the things that I found are just like the tailored treatments, the mental health that help me. The diet, to me, diet is diet, right? I eat to live. But it doesn't help me control my conditions, right? My conditions are genetic and can't be changed by diet. You're not going to fix my heart, by me changing my diet. You're not going to fix my brain. But I do eat as healthy as I can, but I'm a patient and I still have to live my life. And I don't want to live a life of misery because everybody thinks I have to.
So
So I
Dr.
don't. So go ahead. Sorry.
Yeah, no problem.
Yeah, absolutely. And I agree with Christian that our nutritional diet or balance or the food we are taking regularly is not going to help us to tackle our disease. We eat whatever you guys are also eating. But as I know that it's a disease because of the lack of collagen. So I try to have some collagen rich food. But that also I asked to the several doctors. I have not met any doctors of India who always tell that, okay, you have some kind of nutritional diet which can make your fractures frequency lower. It is always going high. So yes, my bones, they always tell, they have a reply, they have a very beautiful thing to say always, that it will go off when you are growing up. So but they never say that what is the age or up to when you can grow up, and your frequency of fracture will go less. So yes, I try to have some collagen rich food, but because of the problems, I used to know that generally initial stage I was being fed with lot of calcium. Star doctor told that because your bones are fragile, it's just like glass. So have some calcium more and more as you feel, so that your bones will become stronger. And that helped that I am having a big lump in my thigh now. My bones are having more calcium, and that made me different. And another issue started in my bones, and that's why I had to stop the calcium. And that the way you are seeing me now, in my childhood I was exactly the opposite. I was so thin, and people used to mock in my parents that, okay, you are having all the food, you are not giving anything to Sai. So that kind of mock also my parents used to hear from the so-called society. But I always used to feel that, okay, I love to eat, but I'm not, everything I'm eating, everything is just going out of stool. My bones, my muscle were not in a position to take it. But after I come to Andhra Pradesh, I started doing this different thing, pranayama and all this thing. I started becoming healthy and healthy, and now I'm quite healthy. But it's a very big time period when I became well seen, and the question where it was like, how your what is the test it was that your disease was diagnosed. Actually, from my childhood, I had done several bone density tests,
Mhm.
and in the first fracture happened in my life, that was 3.5 months old, and so after it gone by three fracture during my 1 year old. My parents took me to Kolkata, what is the nearest metro city, and there the health physicians, all the surgeon people, and all the expertise people diagnose that I'm having OI, osteogenesis imperfecta type 2. It is also having type 1, type 2, type 3. So if you're having type 1, you can have the fractures once in a while, in a whole year. I'm having a type 2. So I used to have different fractures, maybe sometimes 3 4 fractures within a very short period of time. But the type 3 is very severe. They are born with the fracture only. Coming out of the mother's womb, they have the fractures. So
So,
I'm lucky that I'm having the type 2.
mhm.
But it is very difficult to monitor the rare disease. We are not yet that much technologically ahead to monitor why, or monitor the things like, I don't know about Christian perspective in USA, how to monitor rare disease, but India, at least for why, I have nothing to monitor. I can monitor my mental health. I can monitor my positivity, how to tackle with the disease. But the disease is always with me, and only I have to take care with all the precaution. Because precaution always is, prevention is better than the cure. I'm just doing this.
And Christine, do you did you do any like precision? Do you know the next generation sequencing or any genetic testing to get your diagnosis? How was your diagnosis made, and how is it being monitored?
So I do have a lot of different advantages here. I am a member of Stanford. I am a patient on Medicare. So I do have a little bit different care than, some other individuals. Um, but I am part of the human-wide program here at Stanford, which has given me, like I said, the pharmacogenomics. I have a partial genome sequencing. I am working with another company to do my whole genome sequencing and really just trying to figure out what's going on with me, right? Because I did have a diagnosis of lupus that was kind of a catch-all for everything else, right? Everything that I had after that had been attributed to lupus. And if you're not familiar with lupus, lupus is actually, there's not one diagnostic test, but it is a series of criteria. So over the course of my lifetime, there are 11 criteria for lupus. I've had all 11. And instead of looking further into why these things were happening, what we did was then attribute everything to that diagnosis, right? So joint pains were now lupus, when really it was osteonecrosis and I needed to have joint replacements, right? The brain issues and the brain fog, they attributed to treatment and saying that it's lupus, you have brain fog, when really I was undergoing methotrexate poisoning, and it wasn't the drug, right? Everybody freaks out. I want to say these drugs are not the problem, right? They were the right drugs for the right condition, someone my age, my weight, my height. But also, according to my own testing, I metabolize these drugs differently. So
Yeah.
methotrexate, which somebody normally would process in a certain way, I slowly metabolize it. So what happened with that drug was it sat in my system and actually was killing me. And so it got to a toxic point where it was able to cross through my blood-brain barrier.
So, yeah,
And
Christine, somebody is asking how they can participate in the Stanford program that you're mentioning.
so right now it's a program only with Stanford. It's a pilot program. They are looking to expand that program in other places. But again, my nonprofit, we're refocusing, and actually, if I ever get out of this situation, we'll be finishing our rebranding and focusing more on the precision medicine space. So we are going to put together like a best practices for patients looking to do these things, because genetics and pharmacogenomics, and as we're going into this whole genome sequencing, it's a scary space, right? We don't know what's out there. You don't know what you can experience. People are running out to get these tests, not realizing that you could potentially be setting yourself up for a pre-existing condition that may hurt your chances of getting life insurance, and they're rushing out to do this without taking proper precautions. Right. And so as we move into this space, we really need to have discussions around data ownership, what, all of these things, right? What the potential is for all of this and how we all can benefit from these things. Because honestly, last year I was at almost $2.4 million in Medicare costs. And that was not even to treat anything. Right? This is literally just treating symptoms of my diseases and then, and going from there. But also I think as we move further into healthcare, we really need to start listening to our patients, right?
I think that's exactly, Alan has put in the chat box. There's a lot of chatting within quotes with doctor to look outside the box. There's so much time spent with the doctors to make them understand what you are going through. Just for this purpose, for sake of time, I'm going to ask the next question. So I think somebody in the audience has asked, how can people who do not have a rare disease help to support those who have one? And a specific question, how can those of us who are in the US support rare disease patients in India? So Sai, Dr. Sai, do you want to take that?
Yes, if the people are not having a rare disease, they should first clap for themselves, the lucky fellows. I wish them all the best. And it is very, we always doing all the motivation, we always doing all the happiness session, counseling, coaching, everything to make them aware that how much blessed they are with all the abilities, with all the limbs and hands and legs, completely fit and fine, doing everything they can and they want to do. But we have no option. We have to sit in this wheelchair 24/7. Although I like to sit in a sofa, I can't. So that makes our life limited and makes our life full of barriers. But how they can help that, there maybe, we are, my perspective is that from my childhood, I'm against sympathy. I don't want that people will come and do something sympathetic. They can. That's the way people always behave. But I'm just going to change. If we have to change this way of looking towards a rare disease, we have to change our mindset up. We have to make ourselves broad and, widen up. That's why I started researching on inclusion and diversity. Inclusion is something where you include all the people together when you are doing something better for the society. And here we are talking about making the better world. So we have to include people so they can come with the empathy, they can come with the knowledge and with the extended help. So I also see a question here about the national rare disease policy. People are talking about it. Last year they released it, and with the Union Health Ministry of India, they talked about 15 lakh rupees are giving to the people battling with the rare disease people. But how I don't know that how they feel that only this money or the donation from the different funds can help us to lead a better life. Because I'm telling you frankly, because it's a webinar and people need to know the fact, as a 90% different level person, I can't do anything on my own from my morning to night. Like I'm talking with you now, to giving my laptop in a position, giving the mouse under my head, under my hand, everything need to be done. My parents. So I need a supporter constantly. I need a companion. I need a helping hand. So for that, there is nothing from the government yet. There is no extra pension for rare disease. There is all the different kind of problem. I don't want to say everything that governments are trying to help, but they are just feeling that they can make some policy about all this thing, and they're giving some funds towards us, and the problem will be vanished. It's not a magic. It is not something happening one day. It is a day-to-day life. We are facing the challenge. It only happens because you can't walk in our shoes. You don't know. So my main thing, which asking in the question, that one thing I should be always focusing on, that while making the national rare disease policy, at least have a rare disease people with you during the meeting, because how a person who is not having a rare disease can understand the suffering and the day-to-day challenge of a person. So
Mhm.
at least have some people with you who can give you the practical inputs and can give you some light towards the real solution of the society.
I
So that's
agree.
very much needed.
Yep. I agree. That's a very important point, Dr. Sai. And I think we are running short of time. So any closing remarks, Christine?
Uh, sure. In response to how people can help the rare disease community,
Mhm.
honestly, I just want to say that as you're looking at patients and people, look at them with empathy and not sympathy. I don't need people to feel sorry for me. I need people to understand what I've been through and to go from there and to grow from there, right? And so I think as we move forward, really listening to people, really, you know, putting weight into what they say and not looking at people as just patients, right? Because everybody, we do have a purpose. There is, just because you have a disease doesn't necessarily mean you are a burden on society. And we need to stop thinking that way and feeling that way. So we need to really stop walking in and trying to save people and figure out how we empower people to really help themselves.
Yep, very good point. Thank you, Christine. And Dr. Sai, any closing remark?
Absolutely. I agree everything with Christian. I feel that we both in the same boat, and when you are there, you have to care about it. And to the people over the world who are watching now, who are watching to rare warriors, talking about rare disease, I would just like to say that every day you should feel that you are someone in the crowd, class apart. If you are having the rare abilities, you should accept it. It doesn't make you something different. You are also the part of the community. Have the belief to achieve the dream. And that's what I always tell. Yes, we are here, we are special. So what? We are proud of it. We are here to showcase the world that we are also someone, that if we are getting a good platform to work with togetherness, with the harmony and the peace, all everything, we will show the world that how we can shake it with our positivity, with our happiness. So never feel that you are special. You are someone who need to be down. You should come in this world, the life always with the flying colors. Yes, I'm brittle. I'm having brittle bone disease, but I'm not broken. So
Thank you.
that's the way. That's the thing of
Yep.
celebrating.
Thank you, Dr. Sai. Thank you, Christine, for a very interesting discussion. And I would encourage the audience, if you are asking how to be involved in helping, how you can support the rare disease work being done in India, please check out our website. That is what we are trying to do, to bridge the gap between US and India. And with that, I'm going to turn over to Nisha.
Yeah. It was such an informative and insightful session. I found it both grounding as well as uplifting. And I think Christine dialing in from the ER struck a chord with everybody who's here, because it's given, we'd all walk away from here with a deeper understanding of the challenges of, living day to day with a rare disease, which how we can try to understand, but then you're just putting it out there for us to take home with us. And that's an image that I think we will want. And so many people are asking how they can help. And that's such an impactful thing, just by being here. And that's exactly what we want from the discussion. Thank you, Dr. Sai and Christine, for being here. But as promised at the beginning of the session, I think there are a lot of little people here who want and are waiting for our next special session, which is the Art for Rare Awards. And I'd like to call upon our event coordinator, Arokia, to take over and guide this session.
Thank you so much, Nisha, and thank you all for
being here, and thank you for participating. And this is the first art contest which IndoUSrare has conducted, and we are so glad that many people participated and all their arts were very impressive. Can we go to the next slide now? So the theme basically was anything that's rare, and it could be a rare plant, animal, event, or abstracts. And the whole idea of this art contest is to create an awareness among children and adults. And so as a family, everyone could contribute in raising awareness for this rare disease. So we split it into 3 categories. One is, totally we had 35 submissions. And the first category was 6 years and under, and we had 12 entries. And 7 to 10 years, we had about 13 entries, and 11 to 15, about 10 entries. Next slide, please. And all the arts was judged by 2 different judges. One is Miss Avli Dalal. She's a professional artist and teacher, and she has many years of experience in teaching art students for different age group. And she holds a bachelor from arts from Jaipur. And she's also into fashion designing and computer graphics. And she has received the Collegiate All-American Scholar Award from Mrs. Chris Fulmer, Professor of Arts, North Lake College in Irving, Texas. And the other judge is Ms. Ruchi Shah. She's an illustrator and wall artist, is the founder and owner of Creative Rush, and she holds a master's in design from IDC IIT Bombay and a visual arts MA in illustration from the University of London. And they both had, put in efforts to go through every art, and I'm sure apart from them, we enjoyed seeing all of the arts, very nicely done, and I guess the whole team feels the same. So, one second. Let me see my screen. So we would like to show you all the art displays, and then, every art that was submitted will be played here. This is 6 years and under. And Cynthia Vignesh, she brought the state of Rafflesia. Mitri Karur. Next one, please. Yeshua Vijay. Sanvi Purushottam. Sri Adya Putluru. Aditi Swanashima. Rohit Reddy Ranga Reddy. Anika Begapudi. Ryden Lucas. Yukti Srinivas. Arav Rajan. Hannah Folsom. And 7 to 10 years category. Varun Ram Chellappan. Achyut Narayanan. Anvesha Joshi. Karthik Balasubramanian. Madhumika Valabandi. Yashwashin Kope. Naga Shahana Illa. Srushti Vikram. Brooklyn Bird. Shreya Anand. Veena Sharma. Karthik Kajuta. Jay Matthew. And now comes 11 to 15 years category. Arushi Raghavendra. Tarun Lucas. Shreya Kittipati. Shvetlana Topai. And Amulya Karur. Spurti Sri Vidu Rakanta. Sanjana Srivastava. Lakshita Balakrishnan, Samyukta Srivatsava, Nagapurna Hansika Manava. And we really would want to appreciate everyone who participated. It's not about winning, it's more about participating and, giving their best. And every art was incredibly very well creative, very well put together. Since there is a limitation, we have selected about one honorable mention for each category and one award for each category. So we would like to move forward in announcing the categories. So give me a minute. So let's pretend that I am going to show my card to the judges. So Miss Christine will be announcing, hold on.
Are you going to share that with me in a private comment?
Yes. So just like, I'm just going to show you the card and you're going to read it. So I'm going to put it in the chat section. So the first honorable mention for under 6-year-old will be announced by Miss Christine.
Okay. So are we ready for the winner?
Yes.
Okay. So we have, and I probably am going to brutally manipulate this name, but Cynthia Vignesh, is that correct?
Cynthia Vignesh. Yes.
Cynthia. I was kind of close. So congratulations. Are they online with us or?
I think so. Yes, they are online.
Well, congratulations on that.
So Cindy is, you can see the art that she had. Now, next, we move up to the award for under 6-year-old goes to, and Miss Christine will announce it. Miss Christine. Miss Christine, is she there?
You're on mute.
I am sorry. I'm like, for some reason, completely beeping in the background and my nurse is like at the door. So can I have him announce, can I have someone else announce it while I figure this out? Sorry.
That's all. So I'm going to pass it on to Dr. Sai to announce the award for under 6-year-old. Dr. Sai, here you go.
Yeah, so congratulations for winning the award for 6 years and below. And the winner is, guess, the winner is Yukti Srinivas. Congratulations, Yukti, and you have done a great job. And it's such a cute owl. Congratulations once again.
Yes, it's a rare owl blue. And next we move on to the 7 to 10-year-old category, honorable mention, and Dr. Sai will announce it.
Sure. So I really loving this art for here. I'm thinking to go back into my childhood and participate with this. So honorable mention award goes to the next category is Anwesha Joshi. Congratulations, Anwesha, for doing such incredible art.
And the award for 7 to 10-year-old goes to?
Okay, the award for winning the 7 to 10 years art for air competition goes to Srusti Vikram. Congratulations, Srusti. Wonderful. You have done a great zebra. None people have ever seen this zebra in the yellow. So, yes, this zebra is rare. Thank you so much, Srusti.
Yeah, golden zebras have a rare gene that makes them golden. The gene is called leucism, and the United States rare disease symbol mascot is zebra. And
Yes. Wonderful. Congratulations, Srusti.
And now we move on to the 11 to 15-year-old. The honorable mention goes to
Okay, honorable mention for 10 to 15 years goes to Arushi Raghavendra. Congratulations, Arushi. Both tortoises are so wonderful. Congratulations once again, Arushi.
And the award for 11 to 15-year-old is going to be shared by two people. In the first kid's name is.
Okay, we have two people. Wonderful. So 11 to 15 years award goes to, you have to clap for yourself. The name is coming here. Svetlana Thapi, the first, and the second winner is, oh, wonderful, colorful. Second winner is Nagapurna Hamshika Manamma. Such a big name, but you are the winner today. So congratulate and clap. Both of you, big congratulations for winning the Great Art of Rare final. And I wish you all the best. Keep on your painting and create such rare art. Yes, thank you so much.
Thank you so much for participating, and we look forward to participate for you to come back next year too. Thank you, guys.
Sorry about that, guys.
No, you're good. Thank you, Christine, for being there.
No problem. And congratulations to all the winners for the artwork. It was amazing. I loved them.
And we would be sending them the certificates and the awards in their email very soon. So, wait for your emails.
Absolutely. Next time, make some category for adults. We also would like to participate.
Sure, we would do that.
Although I think their art is going to be a lot better than mine as an adult. So I.
Nisha?
Yeah. So thank you, all the children who participated. Thank you both for announcing the awards. It meant a lot to have you on this day, Disease Day. And this brings us to the end of our event of Rare Disease Day 2021. And I'd like to call upon Nara Govindrajan, our board director, to give a vote of thanks.
Thank you, Nisha. Thank you, Christine and Sai. Really an honor and very happy to have you here today. And such a commitment from Christine, being in ER and still making to this event, really hats off. And we are all, highly inspired, and we should, remember that there are no excuses. You have to live and by your commitments. It's really great for you to have been there. Sai, same goes for you. I heard you say that being sick and in pain every day, suffering is an option. That is really uplifting. I normally like to claim that 50% of the world is always depressed, and they don't look at the silver lining. This is something that they should think about. That your sickness is not in your hands, but suffering is an option that you always have. And really glad that you're spreading the message of happiness. And so there goes Christine. You're a living inspiration for everybody. I'm really deeply inspired. And thank you both for being and being with us today and helping us spread the message about rare diseases. We are very, very happy to represent this community of rare disease patients. There are millions of warriors. There are 300 million patients that are there all over the world, 100 million just between India and the US. And hence we are committed to bridging between these two great nations and also across multiple other nations throughout the world. We really take this moment to thank all the warriors and the caregivers of the warriors and other advocates for these warriors, who are day in and day out fighting this. And we will be glad to be shoulder to shoulder with you and stand with you on this Rare Disease Day. I also thank our talented art judges today, Ms. Avli and Ms. Ruchi. It's been a pleasure working with you both and helping us out with this competition. And on to all the children, your art made our lives even more colorful. We really enjoyed. I spent an entire day yesterday compiling all this into the presentation and the website. You can see all this on the website very soon. We will be posting it on our website as well. And everybody are the winners. There is nobody who lost in this competition. Everybody is a winner. We just thought, we wanted to display everything on their website. So we will be doing that. And thanks to all the parents to help children participate. And I think through this process, you all learned, what is to be rare, what rare means. And I think the take-home message for us all is to see how to spread this message across the world, that everybody, is equal. Everybody, the next person to you is 99.9% the same with the genes that they have, but they do get these curve balls in their life, and how they deal with it shows how much of a champion they are and how they celebrate the rareness. And happy Rare Disease Day to everyone on this occasion. At the end, I would like to thank our sponsors and supporters, and also our team members. Arogya has been the main person who initiated this for this year. Very highly thankful to her. And Nisha has been the backbone of this whole event. Thanks to her, and Harsha and Reena and rest of the board members and rest of our team, Siddhi and others. Shout out to you for being there and helping us successfully conduct this event. Thank you so much. Thanks one and all.
Thank you so much, IndoUSrare, and thank you for having us. Thanks to Harsha and all of you. So a big round of applause for you guys for giving us this rare platform to talk about our rare opportunities. We will meet you all soon. Till then, keep smiling and be happy.
And thank you all for the well wishes in the comments. I appreciate it. I'll let you all know how I'm doing as we go forward. But in the meantime, stay safe, stay sane, because our safety depends on your sanity.
Well said.
So, yeah.
Get out of the ER soon.
Thank you all.
Get out of the ER soon, Christine.
Yes.
And thank you, Harsha, for having me. It was
Thank
a
you all.
pleasure.
Great to see you,
Thank
Harsha.
you.
Happy Rare Disease Day, everyone.
Yeah.
Yeah.